Vascular resistance refers to an opposing force to blood flow. When left ventricle pushes blood into the arteries, when blood flows through the blood vessels, if it has friction with the wall of blood vessel, that would be translated to vascular resistance. Obviously, the more friction we experience between blood and the wall of the blood vessel, the more difficulty we have with the blood flow. And clearly, when we move away from the left ventricle, we notice that we end up with narrower blood vessels, and in a much narrower blood vessel, there is more friction between blood and the wall of the blood vessel. That simply means that in narrow blood vessels, resistance is higher. Blood flows through them with a little bit more difficulty. So when we look at all these 5 major blood vessels that we have, in reality, arteries and veins do have such large lumen, the space inside is so large, that when blood flows through them, it barely touches the wall of these blood vessels. So we say that the friction between blood and the wall of arteries or the wall of veins is very minimal. The resistance in arteries and veins would be very small due to the wide lumen that they have. Those blood vessels that contribute the most to the total resistance that we have in our systemic blood vessels are the narrow blood vessels, such as arterioles, capillaries, and venules. Due to their narrow lumen, the space inside, blood has more friction with the wall of arterioles, capillaries, and venules. So these are the ones that contribute the most to the total resistance that we have in our systemic circulation. And we name the resistance in the entire systemic circulation systemic vascular resistance or total peripheral resistance. Now, I focus on 3 main factors that can change how much friction blood could have with the wall of a blood vessel. Basically, the factors that can easily change resistance. And first, I use some examples that all of us are familiar with. If you want to use straw to drink, for example, water, we all know the moment that you use a very long straw, the flow of water is going to be with more difficulty. Because of the length of the straw, you experience more and more friction. The next is if you insist to use a very narrow straw. I'm sure that we all know that it's very difficult to drink through an extremely narrow straw because friction is really high. And in the third image, I see that the straw is exactly what I used first time. However, this time I'm trying to drink something really thick, like a chocolate milkshake. And some of you probably experienced that drinking a very thick milkshake through straw is very difficult because the thicker the fluid it is, it has more friction with the wall and it does not flow easily. So in general, we say that the length, the diameter, and the thickness of the fluid can easily change the resistance, how much friction we experience between the fluid and the wall of the tube. And as a result, the flow would be different. So now if we relate it to blood vessels and blood, clearly we know that when blood vessels are dilated, there is less friction between blood and the wall of the blood vessel. Resistance is low. However, when blood vessels constrict, friction between blood and the wall of blood vessel would increase. Resistance would be higher. And let's recall that arterioles are the master of vasodilation and vasoconstriction. Arterioles in general can significantly change the systemic vascular resistance simply because imagine if the arterioles that we have in your skin, and recall skin is the largest organ that we have, all together constrict. We're talking about a very huge number of arterioles all constricting and as a result increasing the total resistance in our systemic circulation. Another factor would be the length of the blood vessels, and one good example is when we gain unhealthy weight to supply the extra fat tissue, we have to add to the length of our blood vessels. And adding to the length means we're heading toward using very long straws. Friction, resistance would increase. The next one would be the thickness of blood viscosity. We know that in an average size adult, 45% of blood is red blood cell, 55% plasma. For example, when we are dehydrated, we lose part of our plasma, a percentage of our plasma. That makes blood thicker. Or if an individual is experiencing polycythemia, that would be adding to the number of red blood cells. Hematocrit level goes up. So in that case, again, blood gets thicker. But in other situations, such as anemia or bleeding, hemorrhage, that's the moment that we go the opposite direction. Blood becomes thinner. But in general, in any way, if thickness of blood changes, resistance would change too. So in short, as a summary, those three factors that change vascular resistance would be the diameter of the blood vessels, are they constricting or dilating, the length of the blood vessels, and the blood viscosity. And one more time, recall that the systemic vascular resistance, the vascular resistance that we experience in all our systemic blood vessels, is mostly due to arterioles, capillaries, and venules. And more importantly, arterioles, we can say, are the master of changing the systemic vascular resistance because they are very expert in constricting and dilating.